Yo, what's up guys? Hey, welcome back to the channel. Yo man, if y'all new, y'all know what to do. If y'all been here for a while, y'all already know, man. Thank you for watching my channel. Thank you for supporting. That means a lot. And I appreciate each and every one of you that comes on here, takes your time, hears me speak a little bit, talk a little bit. If you don't know, I already made some new playlists. Go ahead and check them out. If you're a new student, there's like 44 videos on that playlist, man. Just play all. Make sure to have a piece and paper ready to get started and take your notes. And it's free game, man. It's free game that no other channel will possibly give you. So today's video, man, is a new career. So it's called an anesthesiologist, basically. Not an anesthesiologist. That word always gets me, man. Aren't there words out there that just kind of get you all tongue twisted? This is probably one of my words. So it's an anesthesia technician. And which is this? And what they do is they clean and maintain equipment. That way the anesthesiologist can use it during procedures, to put patients, to sleep and wake them up. So that's kind of cool, that way you don't have all the responsibility as far as putting the patient to, putting the patient down and having the responsibility to bring the patient back up, because you're worried, that's a hard job, man. I don't think me personally, I don't think I have the heart to do that, because I will probably always be thinking in the back of my head, man, what if this patient don't wake up, or, what if they move during surgery, which I have seen them wake up during surgery, and surgeons are mad because they're like, yo, you know what I'm saying? Like, you're supposed to make sure this patient's knocked out for me through the whole, I don't care if it takes 5, 6, 7, 8 hours, that patient has to be knocked out, so that way, they don't feel nothing, they don't remember nothing, and, they have a speedy recovery, and when they wake up during surgery, man, it's not always nice, man. Surgeons do not like that, you know what I'm saying? But this way, and as an anesthesia technician, you don't have that. You clean the material, you make sure everything's ready, nice, prepared, set out, laid out for the anesthesiologist, that way they can put everything to work and, everything in use during surgery. Now, if you're ever interested in becoming this, the education part is 2 years. So is now you have to do, if you go to a community college, you have to do all the 2-year prerequisites, just like any other modality, like X-ray, nursing, and all that. You have to do your anatomy, you have to do your algebra, you have to do your English 1. Basically all your prereqs. In order for you to get into the program. Once you get into the program, it's a 2-year program, and you can go and, you got to go do clinical sites. I'm guessing you go to hospitals or surgery centers. That's the only place you can honestly work, so that's something to think about, that the opportunities to work are here. Opportunities to work, it will be the hospitals and surgery centers. That's it. So if you decide to go for this career, those are the only 2 places you can possibly work at. And after you do that, after you do your 2 years, how for radiology, we have to pass the AART exam. Well, for anesthesia technologists, you have to pass the ASATT, which is American Society of Anesthesia Technologists. So you have to pass their exam. And once you pass their exam and you're already, you're set, what, I'm ready for the workforce. I done did my hard time of going to school and doing my thing. Then you apply for jobs, and the annual salary, well, the salary for this will be either $20 an hour or $50K a year. So I'm guessing that averages to $20 an hour. I didn't really do the math, to be honest, but that's the information I found. So if you go for this, you'll be expected to make at least 20 bucks an hour. Which again is not bad to get into the medical field and to just clean up. You don't really do anything really patient care. And if you do something, it's probably really seldom, really slight, nothing, life threatening. That way you can kind of ease into your medical journey, medical career. Maybe this either scares you out of medicine and be like, you know what, medicine is not for me. but I'm glad I tried it because I learned a lot. Or maybe like, you know what, I really enjoy this. I'm gonna go for RN, so I can be a nurse anesthesiologist, or I'm gonna go for a doctor, or whatever you see in there. You might like, you might see us in there with the C arm, you know what I'm saying? And be like, what they do? That's an X-ray tech. Hey, I'm gonna go for X-ray. So these jobs right here open your eyes up and your mind up to a lot of possibilities that you can't just do without an education. So, you know, there you have it, guys. You know, leave comments below. Let me know what, you know, careers you want me to go through, or you want me to represent next or talk about next. And yeah, no, I got y'all, guys.